Secondary assessment. So we've done the primary assessment now, we've ascertained whether the casualty is breathing or not breathing. We're now going to go into the secondary assessment, which is effectively starting at the top of the head, working all the way down through the body, trying to ascertain if there are any further injuries. First off though, think about safety. Again, going to get my gloves on. Take your time putting the gloves on. Ensure a barrier between ourselves and the casualty. From there, I'm then going to start at the top of the head and I'm going to talk to the casualty at all stages. Again, if I find an injury, I'm not going to stop. I'm going to keep going until I've finished, and then from there, work out which injury, if any, I'm going to have to treat first. So I start at the top of the head, again talking to the casualties and going all the way through. Just going to start on the head, feeling all the way down the head, checking for any lumps, bumps, indentations. Again, have a look at the gloves to see if there's any blood there. Feel all the way down. Spine should be able to get 4 or 5 discs down the spine. Again, see if there's any abnormality. Come across the top of the clavicle. Again, feel that. That's okay. Look at the forehead. Look for any bruising. Open up the eyes. Again, do they react to light? Are the pupils the same size? Look in the nose. Again, can't see any blood there. Open up the mouth. Have a good look inside. Is there any blood coming out? Again, are there any things like false teeth that are going to have to come out? And finally, feel around the jaw. Again, look at the ears, see if there's any fluid coming out, give them a little pinch, see if the casualty reacts. From there, I'm going to come down to the side of the casualty, back of the hand, pat down the chest. Again, once I've done that, check for any blood on the glove, feel down the ribs. Same thing, feel all the way around the back. Using that hollow, again, checking the gloves, can't find any blood there. Take the abdomen, break it down into 4, and again, propulse each of those different areas, and again, I'm happy there. Finally, just take those hips, just very gently push down onto that pelvis, and again, see if there's any reaction. I've now checked the torso and the head, so I'm now going to start checking down through the arms. Again, all the way down the arm. Is there any shortening of the arm, any lumps, swelling, anything along those lines? Feel for the pulse. Check the nail bed, capillary refill test. I'm also going to look for any medical alert bracelets and also any needle marks. From there, I'll take a pocket, turn out the pocket, ensure that there are no sharp objects in there. All the way down the outside of the leg, halfway up the inside of the leg, feel all the way down, paying particular attention to the kneecap. Look at the colour of the skin at the ankle. Again, leave your footwear in place, just give it a little flex, ensure that there's no crepitus there. From there, I'll go around the other side, check the other arm, check the other leg. From there, I'm then going to put them into a safe airway position so I can then leave them and call for help. So again, recovery position, arms closest to you, up into the air, arm that's furthest away across the body, place it next to the casualty's neck, place your hand on top, take the leg that's furthest away, raise it up, use that as your lever, nice straight back, using that lever, I'm going to pull the casualty across, pull that leg out, and again bring it up into a 90-degree angle to the body. It's going to raise a lot more of the diaphragm off the ground, make it a lot more comfortable to breathe. Pull the hands out from underneath the head, tilt the airway back, and again recheck for breathing. From there, round to the back, feel all the way down the spine, see if there's any further injuries. And finally, I'm going to check the pulse and the capillary refill in that lower arm, and if needed, just move the casualty around until we've got a good circulation there. That is the secondary assessment.